everyone. Welcome to the Near Collaborative ACEs Quarterly, the intersection of ACEs and cultural humility. My name is Laura Ney. I am a nurse in the Parent-Child Health Department at the Snohomish Health District and on the Near Collaborative core team, and I'll be moderating this talk today. The NEAR acronym in NEAR Collaborative stands for Neuroscience, Epigenetics, ACEs, and Resilience. And we're a group of organizations and community members. Our purpose is to promote relationships and environments that help develop stronger and safer families and communities to mitigate trauma. And I'll drop a link to our website in the chat in a bit in case you'd like to learn more about us or join our listserv so you can hear about future events. A few housekeeping items. I know that most of us are familiar with Zoom, but I wanted to point out a few things about the Zoom webinar. The chat for attendees will be disabled so that we don't have a bunch of chat bubbles popping up over Meyleen's presentation. But the Q&A function down in the bottom bar of your Zoom screen will be available throughout the session. So just pop in your questions and then I'll read them out loud to Meyleen at the end. And we'll also drop a link to a survey about this event in the chat, and we do appreciate your feedback. And lastly, this event is being recorded, so it will be posted on the NEAR Collaborative website in a couple of days. So with that, I'd like to introduce our speaker, Meyleen Velasquez. We're really grateful to have her here with us today. Meyleen's a psychotherapist specializing in perinatal and infant mental health. She's also a social work doctoral student, and she's focusing her research on anti-racist and anti-oppressive practices in mental health. Her practice supports individuals identifying as women and clinicians who are practicing from an anti-oppressive framework. Welcome, Meyleen. Thank you so much.
Thank you so much, and thank you for having me. So I am going to go ahead and share my screen so that you can all see the slides. And so, yes, I'm hoping to share a little bit about the intersection of ACEs and cultural humility in the way that I have kind of seen it throughout my practice working in infant mental health, and also as I've seen it throughout this past 2 years that I've spent in a doctoral program, kind of learning about anti-oppressive practices through the lens of cultural humility. And I'll talk a little bit more about how we frame cultural humility. And so you heard a little bit about me and my work, and the main thing that I want to share today is some of the research that I found that hopefully can be useful in helping you figure out how you think about your micro level practice, how we think about the systems that we work within, and how we think not only within the meso system, but also how we think about statewide and national systems that intersect with the populations that we're working with, and that can really help to create safe relationships for individuals and safe environments, but that at the same or populations that are members of historically pressure groups. And so as we sit through this conversation, one thing that is super important for us to kind of sit with as we think about any sort of difficult conversation is to kind of notice whatever comes up for us, whether it is difficult emotions that might rise, whether it is thinking about experiences that we have lived through, whether it is thinking about things that we might have said or done, or that people around us might have said or done, to kind of take that step back to take care of ourselves. And that might mean, taking, like, standing up away from the presentation. It might mean taking a moment of mindful self-compassion, but I think it's important to pay attention to what comes up for us. Because one of the things that we know from the research is that when we discuss difficult emotion, when we have race talk, so when we bring race into a room and into a conversation, we feel strong emotions. And this is one of the reasons why we have so many instances in our society of microaggressions and microinvalidations, because these are difficult subjects to discuss, right? And so I want to acknowledge that and create space for it. Another thing that was important for me to mention in my introduction is that as we come into talks like this, it's important to think about the frame from which we are viewing the world. So what is our lens? And so my lens is that I am a Latina, I am an immigrant. So I was born in another country, came here as a young child. I was also somebody who was undocumented for a very long time. And another kind of interesting aspect of my development is that I have a autoimmune condition that's called vitiligo. And what happens in vitiligo is that your immune system attacks the cells that create melanin. So most of my life, I lived in the world and navigated the world as a brown individual. And about 8 years ago, vitiligo sped up significantly quick. And so I now show up in the world very differently. So something that I constantly have to be mindful and aware of is that as much as I may connect with the brownness that I was born with, that I walk the world with, that it's not a brownness that the world sees right now, right? And so keeping in mind our experience of privilege and our experience of who we are in the world and what the power dynamics are present is important. Being very mindful to not frame privilege as something that's inherently evil or bad, right? It's something that we're born with, it's something that society reinforces it, right? So the goal here is to recognize it and to see how we can use it to benefit the communities in which we live in. And so I'd love to start with this quote by Daryl Wing Su, who is a researcher that has written tons of books in the areas of microaggressions. And so his quote basically talks about how when we as educators, I think as mental health professionals, as nurses, as whichever role or capacity we might be working on, when we don't engage in those critical consciousness conversations, when we don't deal with those things that get in the way of us being able to have real, authentic racial conversations, then we become part of the race talk problem, right? Because we're complicit in not being able to talk or discuss problems that are affecting the populations that we work with. That are affecting our family members, our neighbors, or that are affecting us. And so I always love to also set an intention. So as you move through this presentation, I want you to take some time and kind of think about, what do I want to accomplish? What is my goal as I sit with this work, as I think about cultural humility, as I think about ACEs? What do I want to accomplish? And so to start, we start framing, that the problem with health outcomes, the problem with oppression starts at the beginning, right? And so we think about this systemic issue as structural racism, which is really the legacy of slavery. It's a system where dominant groups continue to advance, and advancement then hinders the progress of non-dominant groups, especially Black people, and that this leads to significant health disparities, right? And so we frame structural racism And we frame the system of white supremacy as not an individual group of people, but really a concept, really, a systemic way of being, that even if we were to take out, and this is impossible to do, even if we were to take out every racism that we've carried, that, is embedded in us, every experience of implicit biases that we have in us, that there's still a system that's going to reinforce power dynamics, and that is going to reinforce the progress of one group over another, right? And that it's not our fault, but we're all in it together in terms of being responsible for shifting the way that the systems work. And so just a little bit of kind of recap as to the ACEs, right? So we know that in the 1990s, the CDC and Kaiser Permanente embarked in this huge landmark study where they saw the relationship between adverse experiences, right? And here we have like a group of the experiences that they were looking at, that an individual had by the time that they were 18, and how those experiences then ended up affecting health outcomes, right? And how they really, what they found was is how they contribute to the leading causes of death in the United States, and how the more adverse childhood experiences that you had, right? And they found that they were extremely common in the population. But the more that we have, the more risk that we have for cardiac disease, for cancer, for depression, for risk of suicidality, right? And at times, right, like those risks can go up to 12 times higher, right? So keeping that framework in mind. And that later on in 2012, the ACEs was sort of expanded through this work that Philadelphia did within their public health department, to expand to these community level adversities that are now make up how we think, when we work with the CDC or with other departments. When we think about ACEs, we include, the experience of witnessing violence, not only as it relates to, having a parent who experienced domestic violence, but also, what we might be exposed, or what children that we work with, what adults that we work with might be exposed, right? Living in foster care, facing discrimination, right? And so when we look at these mechanisms by which ACEs affect health throughout the lifespan, we see that kind of that big foundation, right, of where it all starts. We look at this like embodiment and this historical trauma that different communities experience, and how, I invite you to think about how historical trauma, right, which we call historical, right, because it's coded in the epigenetic, but it's also ongoing. It's also very much present for people of different communities, and that the experience sort of places more risk or becomes more acute the more layers of intersectionality that an individual carries within them, right? And that is going to filter everything, right? So we consider that every group that experiences ACEs is at risk, but that there are some groups of individuals that have higher incidences of ACEs within their communities, and that we need to figure out, how do we help different communities who are experiencing these high, levels of ACEs that are leading to these very significant health disparities? How do we connect with people in a way that is authentic, in a way that is genuine, and in a way that is critically reflective, right? Where I'm looking at my own stuff and really facing the yucky parts of myself, so that as we look to lower depression, to lower cancer, diabetes, to lower risky behaviors, to provide opportunities for people, that we're actually able to provide services in a way that people can connect with, right? So we think about it as a complex problem, right? So we think of ACEs as a complex issue. And that sometimes what we end up doing in a system of complex issues is that then we create very simple solutions to dealing with very real societal and environmental issues that are not easily solved, right? So an example of this might be an organization thinking, how do we reach this group of individuals, right, that are maybe having trouble making it to the office? And maybe the solution that becomes is that we say, okay, let's create a home visiting program, right? And a home visiting program is absolutely crucial, and we know that there are very significant benefits. But without looking and exploring, why doesn't this group of individuals want to engage in services? What are we adding to the mix? What are we doing to engage people? What are we doing to notice, right? And to become more aware of our biases and to become more aware as to how our organization fits into this system of structural racism and what we're doing to add to it or to fuel it. Then we're going to create a problem where maybe an individual doesn't feel comfortable coming to my office to meet with me because they look very different than me, and because they feel like I'm not going to be able to understand them, or because I committed a microaggression that I wasn't even aware of, right? And that now I'm thinking, oh, I'm going to go to their house, right? It's a solution that makes sense, but without looking at the environment, right, we miss a huge picture of what might be happening for people. So we come into this conversation acknowledging that all of us carry biases, right? And that a lot of times, or all the time, especially when we think about implicit biases, that they don't necessarily reflect the way that we consciously feel and think, right? That implicit biases favor our in-group, right? And that we need to be aware of kind of that initial thought that we have and then actively work to develop a different way of thinking and a different way of being that then translates into how we train our staff, how we develop programs, and that in that, how we pay attention to how race and ethnicity, and besides that, gender identity, sexual orientation, socioeconomic status, right? And anything else, right? A number of ACEs, anything else that a person is bringing into the world, how those experiences create risk, and how we need to, in individual relationships and in systemic relationships, create opportunities to really practice from a place of anti-oppression. And I think that the way that we practice anti-oppression is through employing cultural humility, right? And so when we fail to do that, one of the things that happen is that we unintentionally contribute to people's experiences of oppression, right? Because what we're not willing to look at, what we cannot look at, what we do not know that we need to be looking at, it's going to get in the way one way or another, right? And I think that this happens because, one, there's very limited training in critical awareness. So there's very limited training in how am I thinking about myself in relations to others? How am I thinking about my own experiences? How am I thinking about the experiences that I've had and the experiences that I'm never, ever, ever going to have? Right? So an example that I give here is for me to really become aware of the fact that as a Latina immigrant, I have experienced oppressive and microaggressions, right? And, I've had a couple of experiences where I've been stopped by cops because I didn't make a full stop at a light, and that I've been asked, are these papers real? And that maybe, one time or another, I might have been scared, of like, it's dark, is this officer going to, I hope that they don't assault me, right? Like that thought might come up. But at no moment did I ever think, is this the moment that I'm going to die? Am I going to get shot right now? Right? And so we really need to be aware of experiences, of values, of belief systems, and how they layer and how they filter what we say, what we think, right? How we work with people. And that when we don't engage in an analysis of systemic structures and how they interact with each other, we propagate oppression, right? So it's really looking at, if I'm a therapist, so working as a clinician, if I have a tunnel vision and I'm not willing to see how, the organization that I'm developing is working with individuals, or how statewide policies affect my clients, or how right, like the federal system, what's the environment like, and how is the environment possibly affecting policies and then possibly affecting the client that I'm working with, right? So it's this invitation to look past the blame, right? And to look at how do we look more holistically as to what an individual, what a group, what a family is experiencing, and not only, right? So it's moving past this idea that being a Latina creates a barrier, being a Black person creates a barrier to care, right? That it's the system creates a barrier for people that are in certain groups, right? That it's the way that the system is set up, and that we have some power and control over how we organize systems, right? And there's very little that we can really learn and practice and process without introspection. And so as we move through this work, right, we have to analyze what the discourses are. What are the discourses, right? The social constructs that we create, the explanations for things, how we conceptualize things, how do those support marginalization, and how do we contribute to the problem, right? So that when we look at discourses on what treatment compliance is, on how we define distress, on how we define treatment, clients' rights, somebody being resistant, right? Are we looking at it through a social justice lens, or are we looking at it through, a one-sided lens that doesn't look at the full information, right? So if I say something really insensitive to a client, but I haven't had training, I'm not aware that it's insensitive, I'm not exploring it with a supervisor that's kind of checking in with me to, ensure that I'm practicing in a competent way, then I commit a microaggression, client drops out of treatment, as, they should, especially depending on what I say, because people should and, are allowed to protect themselves. But then because in a provider-client relationship, those systems are never fully equal, right? When we're providing a service, there's always going to be an imbalance of power. And so my imbalance of power here is that I'm going to write in a note that the client was not compliant, that maybe the client was resistant, that maybe the client never showed up again, right? And then if we think about, right, this revolving door process, or if we think about, how risk increases people's instances of being involved with child protective services, right? And what happens when records get requested and now there's this note that this individual was resistant and dropped out of treatment, right? So really assessing, right, when something happens, what is the story that I am creating, and how is my story informed? How are my definitions informed? When we sit as an organization to think about what it means for somebody to comply with treatment, how are we defining compliance, and how do we define it in a way that services the population that we're working with, right? That moves away from systemic oppression and that moves towards a system of creating partnerships, right? That when we're looking at the experience of trauma that people are bringing, that we look at the fullness, right? That when we look at ACEs, right, and the number that people might bring, the experiences that people bring, that we really have to layer, right, all these other things that are going to inform the risk that that person is experiencing, right? Because it doesn't stop at, me, scoring 4 or 6 or, whatever on an A score, that we really have to look at, what is this individual's, interaction with the environment, and what does the environment give, right? What is the, I talk about the inner world, but what am I bringing as a provider? What is my organization bringing? What information are we getting from society? And so what is the message that we give to people? So I like to use the iceberg, especially this one, because we see the reflection. You see the iceberg, and then you see the reflection of it. Right? And so you can think about the top of the iceberg as sort of the barriers that people are bringing. And the reflection is, what are we as providers reflecting back when people show up? When we see the challenges that people experience, when we see the struggle that people experience, when we develop policies, what are we reflecting back? What are we saying? What are we giving? Because it is a collaborative relationship, right? If my client shows me something, or if a group of individuals shows me something, and I reflect back a policy, a guideline, a framework, a way of intervening that doesn't meet their needs, right? There's not going to be a partnership. So think about your work, and what are you reflecting back? What are your organizational policies reflecting back? And so one of the things, or one of the solutions that a lot of organizations, and these are kind of national organizations, academic programs, have come up with, is this idea of cultural competency training, right? And so there is a lot of criticism when it comes to how we think about cultural competency. Right? So even though we have this accreditation requirement, which many of us have it as part of our licensure, there's some research that shows that a focus on pedagogy, so a focus on just like learning information, is absolutely not enough for exploring our value system, for thinking, for moving from a rigid way of thinking into a more sensitive and inclusive way of thinking. Because many of us, maybe we had, upbringings where our caregivers were really open and understanding. And, I don't know what word to use, where they were really aware of oppression and marginalization. And some of us didn't, right? I can think of the racist belief systems that I grew up with, right? And how they unfortunately inform how I think and informed the way that I was raised, right? And that we also criticize this idea of having an endpoint to learning, that we can really get to a point that we can know all there is to know about a culture, right? And so some of the critiques are that cultural competency programs teach us to really become comfortable with them, right? So there is a main group, right, which is the dominant group in the United States, and how there is the sense, right, that this main group is now going to get comfortable with all these different individuals. Right. And I remember instances of being taught, what to expect from working with Latino clients, what to expect from working with an Asian client, what to expect from working with an African American family, right? And that it's really disconnected and it propagates stereotypes. The other thing is that when we think of cultural competency, we really lose the sense of intersectional identities that really have to move past the idea of looking at culture as a proxy for non-being white, right? Like culture goes a lot more further than the experience of race and ethnicity that an individual brings. We absolutely need to look at the experience of race and ethnicity because that's going to filter everything, but that's not all that there is to look at when we consider intersectionality. That as we master a knowledge of, the other, and we get comfortable with the other, it's really through a white supremacist lens, right? And so keeping in mind, right, that when we think of white supremacy, we're not thinking about a group of people, we're thinking about a concept, right? A concept that sort of surrounds everything, that informs every policy and every system and everything that we do, right? And that not long ago in 2017, I saw this article going around earlier this year in a journal, in a peer-reviewed journal from 2017, so not long ago, where they were stating very specifically, when you work with this population, this is what to expect. And they had it broken down, like I just mentioned, Latino, Asian. And when it came to the explanation on how to work with Black people, one of the things that the article said was propagating that really, racist belief that Black people have a higher pain tolerance. And this was in a peer-reviewed journal, right? So we're still having fields that are teaching race as biological and not a social construct, right? So sometimes a mistake that we make is that we have a certain awareness of something, and we sort of think that everyone else has that same awareness, and just not everyone does, right? And so, really questioning, right? And cultural competency doesn't push us to look at systems of power and to look at how do we balance power dynamics in a relationship, right? And how do we really change the system, right? So I don't really like the idea of competency. I've had, I think about working for an organization and it being time for me to do my cultural competency training, and me sitting down in front of the screen and like clicking to the end, taking the little quiz, right? And now I pass my cultural competency requirement in 5 minutes. Yay me, but I learned nothing, right? And so when we fail to push our people, ourselves, to engage in self-reflection, right? It pushes us to think about ourselves as the expert, right? Because inevitably, if I don't question myself, then we constantly, as humans, have a tendency to overestimate how much knowledge we have on a subject. We create solutions that don't resolve the issue, right? That don't target the problem, right? So we create the tunnel vision solutions. And then we expose people unintentionally, right? Because all of us, and I want to think that everyone that's here especially is here with a heart of, I'm going to do my good in the world and in our communities. But because there's implicit bias, because there's a system, right, that reinforces marginalization, we expose people to things that could be really great, but that are not appropriate, right? That haven't been reflected on, analyzed, that we haven't met with people from different communities to really partner and check in, right? Like, what is this like, right? We're always going to be running into trouble if, as an organization, I am meeting with, my team to create policies or to create a program to support, I don't know, individuals from X community. And that when I look around the room, there's no individuals from that community represented. We're going to be running into trouble, right? Because what we're going to be doing is that we're going to continue to propagate stereotypes, which I think in part have been reinforced by this belief in the idea that we can learn about someone's culture from attending a workshop, from watching a video, from speaking to a person, one person from that community, right? That we really need to move to that frame, right? That there is a huge difference between truth and facts, right? That when you look at health disparities in Black Latinos, you're going to come up with some health disparities. But that if you only look at it through the lens of those outcomes, and that if you don't look at the truth, right? And I think the truth is the systems that surround that issue, then we're going to come up with solutions that are going to target this part of the problem, but not everything that is informing the problem, right? So if we think about health outcomes as a result of a lifetime of inequities that keep being reinforced day in and day out. And so my invitation is a move from the idea, from the concept of cultural competency, right? And so really, you as a provider, as an organizer, whatever your role or capacity is, to really question training that starts to provide education on a group. That we break away from that false sense of security that because I attended a training, because I did a workshop, because I have a degree, that somehow, now I'm culturally competent. It's a mistake, because we can never be competent in the experience of another human. I am the expert in Meyleen Velasquez. That's the framework from which I can speak on. I can't speak from anybody else's framework, right? And when we start to do so, then it's that time to kind of take a step back and notice, how am I informing these thoughts or this information that I'm giving? And so just an introduction to cultural humility. Cultural humility, even though it seems like a newer concept, has been around for a long time. It's been around since the ACEs. So it was developed by Dr. Thurbalon and Murray Garcia in 1998. They are two Black women medical doctors who were noticing that other medical providers were falling prey to that belief, right? So client asking for medication, provider would say, no, the client's asking for medication, but, I read or I attended this workshop that said that, these types of individuals might be asking for medications where they don't really need it, right? And so they really thought about how do we shift the field from thinking, that you can learn this from just, from not partnering with the client, and how do we help people to move to a place of relationships where we don't harm people because we took a course, right? Or because we gained some information, right? That we think about culture as a fluid experience that is unique to each individual. It's unique to each community, right? But it goes further than just looking at a community, right? We have to look at individual characteristics. And so cultural humility pushes us to engage in a lifelong commitment to self-reflection. And what we're going to reflect on is that we're going to reflect on our values, our belief system, and our experiences. And we're going to take those three parts, right? Values, beliefs, and experiences, and we're going to critique them against the experiences that people from marginalized groups have, right? So this is really looking at my privilege. This is really looking at the experiences that I've had and those that I'm never going to have, right? And it's not a self-defeating thing. It's looking at my authenticity, looking at my story with compassion, but also through a very real lens where I can recognize that I experience oppression. But at the same time, right, I can recognize that I experience oppression as a woman, as a Latina, as an immigrant, right? But that at the same time, even though I don't intend to, I benefit from the oppression that other groups have, right? And that's a hard pill to swallow, but it's the reality, right? And so if we accept the reality while still holding ourselves in compassion, right, that this is not our fault, but that we are responsible, then we're more likely to be efficient and to create policies that can reach people. We layer on cultural humility the idea of intersectionality, right? And so intersectionality is a concept, right? It's part of critical race theory, and it was developed by Kimberly Crenshaw in the late 80s. And it's a way that she helped us to understand how different experiences of inequality really build up on each other, and how the more barriers, stereotypes, identities that we carry, right? The more that the relationships that we have with people, with organizations, are going to meet risks and that are going to experience systems of oppression, right? And so when we look at intersectionality, and this is not a comprehensive list, right? These are just some things to think about. There's probably 1,000,001 things that are missing from here that you can think about, but that's good, right? So thinking about, you know, how the experience of a Black, Latinx, undocumented, non-binary parent, right? How they're going to experience different risks, and how ACEs are going to compound, right, to really affect health outcomes over my experience as a white passing Latina, right? So really kind of pushing ourselves to look at through a lens of experience of being a human is complex, and that we have to look at all these parts as we work with people and groups, right? That we're going to take responsibility for learning, right? So this work of cultural humility happens in kind of a 3 framework, which is didactic, right? So I absolutely need to do my work to learn about implicit biases, to learn about power imbalances, to learn about systemic oppression, to learn about the history of people. And that at the same time, I need to do the work to be reflective about my experiences, right? And the ones I'm going to have and I'm not going to have. And then the third way that this work happens is relational. So I need to be able to collaborate with other people, to have conversations with other people, to really look at power balances that are present when I sit with, I sit on a board, right? As we look at the board and, we're working on developing a racial equity framework, right? Who is represented in the board, right? Because it starts at the micro level. To be able to look at our blind spots, right? And so I was talking about implicit biases a little bit earlier, and how they really favor our in-group, and how they may not fit our conscious belief system. And that's an important thing to keep in mind, right? So consciously, I can truly and fully believe that all humans are equal. I can truly and fully believe that race and gender, right, that they are, I lost my train of thought, right? That these things are like social constructs, that we created these definitions and that we oppress each other by these definitions. But what I carry inside might be different. It's usually different, right? And so I need to be aware of that so that I can work with it, because we cannot work with that which we do not recognize or we don't talk about. And some ideas for this process, right, is that as you engage in these periods of self-reflection or relational conversations with people in your organization, that you look at, what are my attitudes towards people who are different than me? And then you ask it again, what are really my attitudes towards people who are different than me? When I'm sitting with this client, when I'm sitting with this community, how are they perceiving our interaction? Because maybe I'm thinking I'm amazing, but maybe that's not the experience that my client or my community are having. And how do we as an organization truly partner with people to assess their experience, right? Keeping in mind, right, that if we're going to serve a community, we cannot create programs without their input, right? That doing so propagates oppression. Right? And, what are the power dynamics that are present? Right? that as I'm looking to develop a program, right, if I am having, I don't know, an individual from a dominant group. So maybe I have a therapist or a nurse providing services, and they're a white provider, cisgender provider, and the supervisor is a white cisgender male, and they're providing services to an individual who's a member of multiple minority groups. What are the power dynamics there, and what are we going to be missing, and how do we work as an organization to be different, to be better, to be more inclusive, right? Recognizing that there are going to be limits to our understanding, and that, you know, in those limits, the individual's reality is going to be different, right? So when I think about possible conditions that the person might be experiencing or that might be affecting them, I have to think about those as hypotheses, right? That they're informed by my blind spots, by my implicit biases, by my, you know, unconscious racism, by, you know, by a system of structural racism. And so my reframe is that I have to be able to look at, how do I gain awareness of my blind spots? How do I engage in reflection? How do I have conversations with people so that I can be accountable, right? And this is really also an invitation to move away from something that we've created in our society, which is a call out and a cancel culture, right? Where like you say one thing or you make one mistake and now you're, you know, the worst, evilest human being that has ever existed, into a place of calling in, right? That when our organizations, when my colleague says something, that I can have a conversation with them where instead of calling out and being accusatory, right? Because that never works, because we don't do that with clients. If my client relapses, I'm not going to go scream and yell at them and tell them what a horrible human being they are. I'm going to partner with them. And so we have to move to a framework of partnering with each other where I can say to them, hey, you know, when you said that, I heard it in this way. Can we talk about that? I'm not sure that you meant it that way, right? And where we extend invitations to each other for growth, because we can't do this work alone. And so the ongoing practice here is to really gain knowledge. And gain knowledge from multiple sources. So yes, it is important. And I know that there's some issues with this book right now, but it's important to learn about white fragility, right? And to read the book. But it's also important that we're learning about systems of oppression from people of color, and that we pay people of color for their work, right? So really, right, moving from a framework of tunnel vision into a more extended. And that when we gain knowledge, that we also question it, that we question it in relationships, that we question why we're questioning, right? And that we're listening. And so we cannot do the work of listening if we're not inviting the voices of people who belong to those groups to help inform the way that we work, to help inform what we do, the policies that we develop, how treatment is going, right? And that when people share with us their truth, that we validate it. Because at one point or another, we're probably going to make a mistake. There's probably a mistake that I already made in this talk, right? Because we're human. And so the frame here is that we're all in this together. And that in order for it to work, we really have to come to terms that we're all in this together. So when the time comes that somebody says, hey, Meyleen, you just said something really insensitive, that the best thing for me to say at that moment, and to mean it, right, so that it's not performative, is for me to say, you know what, I hear you. Let me sit with that. Let me think about it. And if it's okay with you, if you would like, if you're able to, can we talk about this later? So that you can take a step back and kind of look, right, at what happened. right? What came up, what transpired, right? As opposed to reacting in the moment, right? And so that we're not taking away from, what somebody else might have experienced. Right? So that as we're looking, right, and we know that the best thing to lower these negative outcomes from ACEs is how do we engage people so that we can provide this safe, stable, nurturing relationships. But if we're going to provide safe, stable, and nurturing relationships, we cannot do it without the frame of cultural humility, right? We cannot look at our programs that we're developing without, really assessing whether they're effective for the people that we're working with, right? Whether we're really recognize that the research that's informing the programs that we develop, the interventions that we put in place, right, is a system that is also affected by structural racism and white supremacy, right? And that there's a very few research when it comes to the experiences, right? Not the outcomes, but the experiences of people of color in counseling and receiving services. And there's even less when we add intersectionality, right? And that when I do a research, when I put keywords in a scholarly like database, right? And I look for Latina and perinatal mental health, that a lot of the outcomes that I'm going to have, or a lot of the results, are going to have a qualifier, right? And the qualifier is usually going to be poverty, low income, right? And we recognize that there's an intersection between poverty and being a member of a minority group, but that we also have to think about how, if all these research has this qualifiers, right, what is the discourse there? And if the discourse is an oppressive discourse, then as I'm developing this program, are people going to feel like they can trust us, and are people going to engage if they don't feel seen and they don't feel heard? And so I just wanted to share briefly about this study that was published in 2016. And so what they did is that it's a pretty large study. They had about 2,000 individuals from different racial and minority groups who had participated in counseling. So this was community mental health. And what they found was that about 81% of all the individuals who participated had experienced at least one microaggression that was not addressed, right? And that led to an outcome of usually dropping out of counseling, right? So it's switching the frame, right? What are we doing? Right? That as we, and this is a framework from, her name is Loretta Ross, and she is activist, scholar in the area of racial justice when it comes to reproductive health rights, right? And so she talks about, the 90% being the people that are out there kind of doing the work, really being aware of, how to dismantle these systems of oppression. The people that are at the 75%, being people who want to do the work, but maybe are not there just yet. The 50% might be the people who might be saying things like, yes, there are disparities, but if people just did better, right? If, undocumented migrants wouldn't come to this country undocumented, or, if people from the certain group were to behave well, then they wouldn't get in trouble. Then we have the 25%, which might be the people who are like openly racist. And then the 0%, the people who might be the KKK card carrying members, right? And how we make this mistake as organizations where, maybe we're in the 90% and we want to influence the 25%. And then we really have to think about, how does our organization begin to work with the 75%? And checking whether there's a 75% in an organization, right? Because we have to start where we're at and then build on from there. But if we keep fighting with each other, what's going to happen is that the 0% is going to slowly, right? It's going to go the other way, and they're going to begin influencing us. And that's absolutely a thing that we cannot allow to happen. So as we work with systems, we think about kind of that first question, am I ready to embark in this work? And if I am, then I have to sit with my experiences. I have to sit with my value system. I have to invite my staff to look at their experiences and their value system and to create safe spaces where people can do this, right? Because we can also, again, tunnel vision, pretend that now we're going to sit a group of people from diverse cultures and experiences, who some might be in the 90% and some might be in the 25%, and that, we're going to have these discussions, right? So we really need support to do this. But that if we're going to do it, right, that we discuss psychoeducation on all these systems, implicit bias, that we provide psychoeducation and cultural humility. And you can do that with a consultant. You can do that as an organization, beginning to have conversations from the framework of none of us are experts in somebody else's culture, but we're going to come together to do this work, right? And that we're going to set the expectation that the work is not going to end at this talk, at this meeting, at this training, that the work has to be long-term commitment to shifting the way I think about the world and to really understanding what has led to the shift, right? What led to what informed the way that I work, right? And I can say that for me, one really big thing that shifted the way that I think about myself and the world was working one-on-one with an anti-racist coach. That if it hadn't been, kind of that safe space where I was really able to explore the racism that I grew up with, the racism that I have experienced, right? That I wouldn't, I don't know that we would be here having this conversation, right? So the work starts internally before, right? It starts at the micro level before we can move it to the meso. And that when we're thinking about systems who are not ready to do the work, the first thing that we have to think about, I have here protecting the provider, but you also have to think about protecting the client. And that, if there's a client, a system, an organization that's unwilling to do the change, you can try to have a conversation with them, right? With the informed consent in mind. But if someone's not willing to do the work, we cannot start to do the work, right? We can set limits, we can refer out, we can choose not to partner or not to, work with organizations that are not doing the work, right? But we cannot say that we are moving towards social justice and partnering with organizations that are not doing anything, or that maybe are hindering progress, or that maybe at the last meeting you heard X and Y leader say something really messed up, right? And we cannot say, well, this organization is doing such a great job, it's just like this person in leadership is a racist, right? That we really have to think about how we're adding, right? Because to not say anything, to continue to partner with people, to continue supporting systems that are creating oppression, is me being a participant in the oppression of a group. And so as you continue the work, right, constantly assess, critically assess power, privilege, dynamics, intersectionality, and how what we're creating, right? So if I create a policy, if I have a way of working, how is that interacting with my client and informing my client? How is it interacting with the community? How is it interacting with state level and national laws? And how are state level and national laws informing my practice? How is my community informing my practice? And how is my client and the people that I'm serving, how are they informing our practice, right? So that we move from this really unstable balance of power into a balance of power that's a little bit closer, right? We're never going to get it here because that's not the nature of providing a service, but that we could get it closer to where we're partnering with people and really aware that systems are fluid and that they inform each other, right? And who am I listening to? Right? When I develop this way of thinking, when I develop this way of practicing, who is informing me? And so the last invitation, right, is to really partner with other people to develop protocols, right, that really decolonize the literature, right? And so I have like 3 questions I encourage people to ask as you're looking at a policy, at a research. Who was it created for? Who created it? Who was it tested on? Who is it for? Right? And what we tend to find is a lot of interventions have been developed by a very specific group of people, tested on a very specific group of people, and so hence developed for a very specific group of people. And so if we're going to create programs that, I have here like the 4 essentials of childhood framework from the CDC, right? So if we're going to create programs that are going to raise awareness and commitment, to build partnerships that are going to use data to inform outcomes, are we looking at the full picture? Right? Are we looking at how structural racism informs the system and how the system then informs structural racism, right? So that we can constantly do this. And this work gets exhausting. We can't do it without relationships, right? And we can't do it without practicing self-care. Right? So again, when we look at these yucky parts of ourselves, we're not going to feel good. It's going to feel bad. But we can look at it through self-compassion, right? That I'm looking at these parts of myself, at these parts of my organization, at these parts of my work, but that my commitment is to be able to provide help, to be able to help my community, to be able to continue growing, right? And that I have to take care of myself in the midst of it all, right? So that I can really become aware of when I accidentally at an organization, develop really simple solutions to a complex problem, right? In your organizations, you can review policies and procedure, get information from your clients and see, how they feel, what they think. Check your intake paperwork, right? Something as simple as, you have a question on gender, leave it like, as opposed to giving people bullet points as to what to choose, leave it open and have people identify themselves, right? Not in that tunnel vision framework that we might want to give people, right? Ask people about their experiences, right? And reflect on the language that we use, right? Because reflect on your discourses and your definitions for things, so that as you think back, right, to this idea of what am I reflecting back to my clients, what am I reflecting back to the organization, hopefully I can reflect something that is kind, compassionate, authentic, right, that actually meets their needs, right, and that helps to lower the amount of pain that people experience, right, that helps to partner with people, and that could be more effective if it accurately reflects what a person is experiencing, or at least compassionately. So that as we look at, how do we apply all these wonderful programs that organizations, right, and that national policies have come up with to lower, not live the outcomes, right, or the studied outcomes of high numbers of ACEs, that we can actually make it happen because we're creating programs that don't only touch a part of the population, but that also touch the vastness of human experience, of what it means to be a Black person, what it means to be a Latino, what it means to be a person from a certain religious group, what it means, right? What it means, what the human experience means, right? As you consider race and ethnicity, because we have to consider race and ethnicity. and then the layers of intersecting identity that a person might have. So that as you create policies, right, that are going to serve children, that are going to really create connecting relationships with adults, right, that are going to reduce systems that create stress, right, that affect, early death outcomes, that they can actually be responsive, right? Who is informing them? Who is it made for? Who is it created for? Who is it tested on? How are people perceiving it? How am I informing my practice? Right? And going back to this question, and sometimes when I think about, the responsibility for supporting oppressed populations, one mistake that we make in society is like, an acknowledgement that one, this has been a really tough year, but that aside from 2020, it's a tough life, right? And all of us are carrying a lot. And so sometimes when we think about responsibility, I think of like people in a group, right? And everyone's pointing at each other, right? And we're hoping that somebody else can come and have a solution, right? Whether it's somebody who's more in power, whether, it's an organization, an association, right? But that really starts with us, right? That we are the ones who are responsible for advancing basic human rights of people and services that are going to really help to interject, right, those really negative outcomes that we're trying to lower regarding ACEs, right? So there's a solution for it, and we're it. It's good and bad, right? Because we're it, which means that we have to do it, right? Which is good and bad. So that is all I have for us to share, or to share with you all regarding what I've learned this year, these past 2 years in my program in terms of cultural humility. These are some ways that you can reach me and stay in contact. And I guess now I will take any questions that might come up, any feedback. I don't know if we want to.
Yeah, we can
Yeah.
get started.
Okay, there we are.
Thank you, Meyleen. And we do have some great ones in the question box. And if folks have more, just click that Q&A button and type it in. And so this first one is a question about representation. For example, when we're developing a program to help a specific community and ensuring that people from that community are seated at the table. I've learned from activists in the social justice world that it's inappropriate to ask or expect people from marginalized communities to do the work of deconstructing harmful power structures, for example, white supremacy. How do you walk this line? Recognizing the importance of including the voices of marginalized communities, how do we avoid the presumption of placing the burden of teaching the people in the dominant cultures?
Yeah. That is a really, really excellent question. And I think that I don't think that there's one way to do it, but how I would bridge that would be, one, thinking about as an organization, how do you embark in a true process of cultural humility where, you take responsibility for learning, right? So kind of taking responsibility for learning what is historically and socially the challenges that the barriers and oppression that people from a certain community experience, right? How do you engage in that process of critical self-reflection as an organization? And then you can think about inviting people, right? And so I would encourage you to invite people who are doing the work, right? So a way to start would be inviting, consultants who have a specialty in, they're members of the community, right, that you're studying or that you're working with and partnering with, and then pay them. Because I think that what has happened traditionally is that we have invited people from certain communities, usually vulnerable people, so usually consumers, and then we kind of place a responsibility on them teaching us, and then we don't even compensate them for it, right? So that's a frame that I would use, right? So practicing cultural humility and then inviting somebody who is from that community and has, that capacity to teach. And we live in this technological era where we can really invite someone that's maybe, not in our city, right? Maybe not in the state, right? I think that if we look, there's going to be people in our state, but that we can really connect with people in a different way.
Mm-hmm. Thank you. So you referenced the often poor cultural competency training organizations often provide to employees to check off the box. How can organizations do better to incorporate the principles of cultural humility into their practices beyond a one-time training?
Yeah. So I would say, like, starting with throwing away the cultural competency trainings that are not working, right? Because you cannot do this work with just didactic information. It has to be reflective, and it has to be relational. So I would invite companies to either work with a consultant or to maybe purchase trainings or protocol that are based on cultural humility. And there's tons of trainers on cultural humility that you can bring in, and that it cannot be a one-time thing that you do once a year or that you do every 6 months. It needs to be integrated into conversation. So I can share something that we're doing in the board that I'm a part of, is that we have integrated some learning between, so we have a monthly meeting. So between the month, we have a learning, right? That's designated for us to, usually some videos to watch on different topics. And then we have a reflective question, and we've carved out time so that each of us reflects on this, right? So, reflecting is not the end of the game, right? It's one piece of it, but it's the foundational part. We have to create spaces for having these difficult conversations with other people. And if we don't do that, right? If we think, even within cultural humility, maybe you bring, this amazing trainer and they do like a 2-day workshop for your organization. But if there's no follow-up within the organization, if we just say, okay, I'm good, then, right, we're going to fall trap to a system that doesn't work, right? So taking the same approach that we would in anything else that we learn, right? I don't know, I'm trained in EMDR, right? So my training, the initial training, was not the end all and be all, right? I had to keep up with my training. And so the same things that we use, right, bring it into cultural humility. It needs to be a continuous conversation.
Definitely. And we have another question that's kind of related to that too. How do we promote these principles of cultural humility within an organization when there's that barrier of leaders not seeming to understand the concepts or the importance and not supportive of that continued learning?
Yeah, that is a really, really hard situation to be in, right? Especially if, we think about power dynamics, right? So if, like, I am a member of a minority group and I'm looking at my organization and the leadership, it's all members of dominant groups, and, they're not open to it. I can be in a really vulnerable situation, right? If I go and I challenge. So maybe a place to start, right? Because we cannot all say, ideally, we can say, okay, if there's an organization that's not supporting us, then we're going to leave, right? But that's really easy for me to say. And that's not the reality of the world that we live in, because we all have bills to pay and families to maintain. But I would say starting with maybe building a group with other people who are interested in doing the work and starting that way, right? Whether it's a consultation group, whether it is a supervision group, right? Whether it is other leaders that might be interested within the organization to create change, right? So thinking about partnering with people that are like-minded, right? So if we think about the circles, right? If we're in the 90% and we have, an organization that's, at a 25%, we're not going to be able to influence them. And that we might be in a really vulnerable position. So I often think about, we place kind of this burden of information on people from marginalized communities, right? Like sometimes a group of people will sit in a room and we'll have a conversation of, cultural competency. And then like everyone will turn around and look at the one person from the minority group and expect them to kind of have all the answers, right? Which is really propagation of oppression. So we really want to move away from that and just partner with people that are like-minded, right? And begin there.
Definitely. And this one is kind of more on that micro level. So as a white provider, if I realize that I've committed a microaggression when working with a client, do you have recommendations about if or how to circle back with them to talk about it?
Mm-hmm. Yeah, absolutely. So if the individual that, if we committed a microaggression with our client and we recognize it during the session, this is like my words, so you would put it into your own words. But I would say something like, wait a minute, the way I just said that was really insensitive. I'm sorry. Can I rephrase that? Right. So I think authenticity is the most important tool that we have. And so recognizing, I just said something really messed up, right? I'm trying not to curse in this training because I have a tendency to curse. So, I just said something really, really messed up. And, I apologize for that. Let me rephrase that, right? And then the client is going to take it or leave it. What we don't want to do is that we don't then want to explore how the client's feeling, what it was like for them, right? We don't want to do that. If maybe I committed a microaggression and I don't recognize it until 3 sessions later, I can circle back and I can say, you know what, this week I was thinking about something that I said a few weeks ago. And I just wanted to check in with you because I'm realizing that that was really insensitive. And, I learned that that was a microaggression. So I just wanted to take some time. We don't have to talk about it, if you don't feel comfortable, but I just wanted to like recognize what happened and take ownership for it.
Okay. And then I think we'll just do 1 or 2 more questions. So do you recommend that providers screen for ACEs in their practice using a questionnaire? Do you feel like that's a helpful practice? And how do you make that personal and not re-traumatizing?
This is such a complex question, right? Because I think that there's a value to screeners. And I think that my worry with removing screeners completely is that then people just won't screen. So I think it could be okay to provide the questionnaire, but it cannot happen on its own. It needs to happen with an interview. It needs to happen within the framework of a clinical interview. It needs to be trauma informed, which means that, I have to be really mindful to not ask intrusive questions if, I don't need to know the information, or, and usually we don't need to know the details of someone's trauma, even when we're doing therapy. And that we need to give people the kind of that little message that says, you can fill in as much as you feel comfortable about this. If there's anything in here that may not feel comfortable, like it's okay. We can talk about it at a later time when you're ready. Mm-hmm. And to check in with people, right? So maybe we provide screeners at before we meet with a client, right? So they come into the office and they fill out all these forms. And then when we sit with clients, we have to really acknowledge, like, I know that there was a lot of forms that you filled out. I'm wondering if you have any questions. How was that like for you, right? So really show up authentically to check in with people, right? And to build relationships.
Thank you. I think we have one more and we'll wrap up. So how can people of color protect themselves from the daily effects of microaggressions and oppression when they're in an organization that doesn't practice cultural humility?
Sometimes if we're able to, it might mean that it might not be safe for me to work in that organization, right? Or for us to work in that organization. And it might mean that, unfortunately, like I do it as long as I need to while looking to leave. Some of us do this work because this is the work that we want to do. This is not everyone's work, which is one of the reasons why I think, when we think about how do we change organizational culture, I think about working with a consultant who is trained and who is being paid to do that work, right? But if that's not the work that I'm doing, if I can't do that emotional labor, right? If I'm really recognizing the tolls of these daily microaggressions of, the suffering that I'm being put through, I have to be able to protect myself. Right. And, thinking about relationships is important, right? So how do we have a space to vent and to connect with people that are in our circle? To really think about working with people who are, like other members of your community or friendship who are doing, or who are open to doing some racial trauma healing, right? Even if it's just like sitting together and talking. But I think about protecting ourselves. And that's my main thing. So when we were talking about systems, when systems don't work, so if you are a supervisor and your supervisee who's a member of a minority group tells you that a client made a microaggression towards them or it's being really racist towards them, then we have to think about protecting our providers and not expecting them to, tough it out with populations that are hurting them. And I think we have to do that for ourselves. It is not okay. And unfortunately, it is not always safe to go up to an organization and to say, hey, this thing you did was really racist and hurt me. Hopefully we can get to a point as a community where, we can really create spaces for that. But yeah, there's no easy answer to that. And more people than should experience that on a daily basis, because we think that we know a lot more than what we know.
Okay. Thank you so much, Meyleen, for expanding on those concepts and just encouraging us to reflect in a more deeper, holistic way. I really appreciate it. I'm going to drop those links in the chat now that I mentioned to our website and to the survey. Thank you, everybody, so much for being here and being willing to explore this topic. Yeah. Thanks, Meyleen.
Yeah. Thank you for having me, and thank you for the opportunity to share. I hope that it's useful and helpful to your practices.
Thank you. Everybody have a great afternoon.